We're going to discuss the Enterobacteriaceae part 2. So let's start with the EPIC, which EPIC does not produce exotoxin. They are associated with attachment and effacement of the intestinal cell wall, causing attachment and effacement lesions in the colon. An example of it is an E. coli 0111 and 0125, which there is a serotyping. Then the EAEC is associated with the aggregative regulator gene, the AGGR, and they are responsible for cellular adherence. There's two typically are not bloody and do not contain pus cells. Inflammation is accompanied by fever and abdominal pain. So, to summarize things up, the organism of Escherichia coli as a cause of extraintestinal infection, their virulence factor are several, including endotoxin, capsule production, and pili that mediate attachment to host cells. Their spectrum of disease and infection is the urinary tract infection, bacteremia, neonatal, meningitis, and non-nosocomial infection of the various body sites. Most common cause of gram-negative healthcare associated infection. Then the next organism would be enterotoxigenic or E. coli or ETEC. Their virulence factor is that pili that permits gastrointestinal colonization, heat-labile and heat-stable enterotoxins that mediates secretion of water and electrolytes into the bowel lumen. Their spectrum of disease and infection are travelers and childhood diarrhea characterized by profuse watery stool transmitted by contaminated food and water. Then we have entero-invasive E. coli, which there are the virulence factor uncertain, but organism invades and ecterocytes lining the large intestine in a manner nearly identical to Shigella species. The spectrum of disease and infection are dysentery, which includes the necrosis, ulceration, and inflammation of the large bowel, usually seen in young children living in areas of poor sanitation. Then we have the enteropathogenic E. coli or the EPIC, the next organism. Their virulence factor is that the bundle-forming pilus, intimid, and other factors that mediate organism attachment to mucosal cell of the small bowel, resulting in changes in cell surface, including loss of microvilli. Their spectrum of disease and infection are diarrhea in infants in developing low-income nation can cause chronic diarrhea. In the enterohemorrhagic E. coli or STEC, their virulence factor are toxins similar to Shiga toxin produced by Shigella dysenteriae, most frequently associated with certain serotypes such as E. coli 0157H7. Inflammation and bleeding of the mucosa of the large intestine, including hemorrhagic colitis, can also lead to hemolytic uremic syndrome, resulting from toxic-mediated damage to kidneys, transmitted by ingestion of undercooked ground beef or raw milk. Then the last organism that we're going to talk is the enteroaggregative E. coli or EAEC. Their virulence factor probably involves binding by pili, ST-like, and hemolysin-like toxins. Actual pathogenic mechanism is unknown. Watery diarrhea that in some cases can be prolonged mode of transmission is not well understood. Okay. So the Escherichia coli or the colon bacillus, they are normal flora of colon. Important human pathogens that UTI, CNS infection, sepsis, endotoxin, induced shock, and diarrheal disease. Oropathogenic UTI, there are E. coli, most common cause of community-acquired UTI. The diarrheogenic E. coli. So, let's talk about the ETIC or the enterotoxigenic Escherichia coli, which there are watery diarrhea, no WBC, and no RBC, causing travelers diarrhea, Montezuma's revenge, turista, production of heat label and heat stable toxin. Serotypes are 06, 08, and 025. Now we're going to discuss the EPIC enteropathogenic Escherichia coli, which there are infantile diarrhea. There are non-invasive. Their serotype is 0, 1, 1, 1, and 0, 1, 1, 4. Then let's talk the EIEC, which it preserves as the entero-invasive Escherichia coli. They are Shigella-like infection, dysentery-like symptoms, invasive bloody diarrhea. Their serotype is 0124, 0143, and 0164. Now, we're going to talk the enterohemorrhagic Escherichia coli or the EHEC, which there are watery to bloody diarrhea and colitis. Their virulence factor are virotoxin. Most important strain is the 0157H7, implicated in an outbreak of hemorrhagic diarrhea, colitis, and hemolytic uremia syndrome or HAS, Hamburger disease. The selective medium employed is the smack or sorbitol macaque agar. Their expected colonies is EHEC or 0157H7. There are colorless colonies on smack. Now let's talk about the EAEC or the entero-adherent Escherichia coli or the stack brick pattern. There are non-sorbitol fermenters. They are implicated in diarrhea and UTI. There are two types, diffusely adherent E. coli and entero-aggregative E. coli. So how is the setup done in the doing the manual identification of bacteria and how to ID? First, always start with the plate for characteristic growth of the organism, whether in MAC or EMB or in the BAP. Second, look for the key feature of the biochemical reaction. Memorize or familiarize at least 3 the usual biochem tests. I take note is the TSI, IMVIC, usually indole and citrate, MIO, LIA, the PAD, the PAP/PAF, and the sugar fermentations. So this is the EMB third year E. coli, which it uses the macrotein media used in actual workplace. The E. coli and the E. coli. Okay. So the pad, we're going to use the pad, it's brown. The TSI is yellow. And the SLA is green in the E. coli. So that's good enough. So the genus Klebsiella, it is a species are inhabitants of nasopharynx and gastrointestinal tract. Cause liver abscesses, primary pneumonia, UTI, wound infection, septicemia, meningitis. The key pneumoniae, the Friedlander's bacillus, there are EMB or MAC is equal to large pink mucoid colonies. There are capsulated non-motile urease. There are lactose fermenters, aerogenic, TSI equals IMVIC, which equals to negative, negative, positive, positive. Their key pneumoniae containing K1 capsular clonal complex, or the CC23K1, is associated with pyogenic liver abscesses. Presence of another K1 capsular complex, CC82K1, is associated with severe pneumonia and septicemia. Those that demonstrate a hypervirulent, hypermucovicious phenotype, HVKP, are resistant to bactericidal effect of serum complement and neutrophil. They are resistant to ampicillin and may demonstrate multi-drug resistance because of plasmid with enzymes such as carbapenemase and cephalosporinase. Now we're going to talk about the K-oxytoca. It has a heat-labeled cytotoxin, has been isolated from patients with self-limiting antibiotic-associated hemorrhagic colitis, and that's the oxytoxa. Then we have to talk about the K. rhinoscleromatis and K. ozyniae, which they are agent of chronic infection, the rhinoscleroma and atrophic rhinitis or N-uzina, which it's kind of sticky actually. So E. coli versus K. pneumoniae on MAC, can you describe their colony morphology difference? So in the E. coli is more likely a liquidish thing, while in the pneumoniae it is forming more form things. So we're going to talk about the Klebsiella granulomatis, formerly Calimactobacterium granulomatis. Granuloma ingonili or donovanosis is a STD by genital ulceration and inflammation, difficult to cultivate in vitro. Scrapping of lesions, Wright's or Giemsa stain. Their Donovan bodies is bacteria stains as blue rods with polar granules, safety pin appearance, large pink capsule with enlarged macrophage. That's their size. Klebsiella, their normal habitat is in the gastrointestinal tract of humans and animals found in environment. Causes opportunistic and nosocomial infection, UTI, pneumonia, and wound infections, K. pneumoniae. Their common name is Friedlander's bacillus. Causes lobar pneumonia, Courant jelly-like sputum, UTI, lower respiratory tract infection, while K. oxytoxa is similar infection caused by K. pneumoniae. Their unique biochemical test is that adult is positive in Klebsiella. So this is Klebsiella pneumoniae. As you can see, it is pink and reddish background, and they are pink. So we're going to, the pad is kinda dark orangey, and their TSI is yellowish, and their citrate is blue. We're going to discuss the genus Enterobacter. The small capsule is less mucoid colonies. The EMB is the fish eye colonies. There are motile, there are lactose fermenters, and there are aerogenic TSI. Then their IMVIC is equal to negative, negative, positive, positive. The three species commonly encountered in the lab is the LD carboxylase and the OD carboxylase. So we're going to start with the E-cloke, which there are the LD carboxylase is the negative, while the O-decarboxylase is positive in the Enterobacter cloacae. In the Enterobacter aerogenes, the L-decarboxylase is positive. At the same time, in the O-decarboxylase is positive also. In the Enterobacter agglomerans, the L-decarboxylase is negative, while in the O-decarboxylase is also negative. Their urease is negative in the Enterobacter, except species of Enterobacter cloacae and Enterobacter agglomerans. The Patoe agglomerans, new designation of Enterobacter agglomerans. There are yellow pigmented colony. There are lysine decarboxylase, ornithine decarboxylase, and arginine dehydrolase negative. The Enterobacter cause nosocomial and opportunistic infection. Their UTI, respiratory tract infection, and their wound infection. They are aerogenic. The Enterobacter aerogenes are negative for urease. The Enterobacter cloacae, and Enterobacter georgioveae from respiratory specimen are urease positive. Chronobacter sakazaki or Enterobacter sakazaki, their production of yellow pigmented colonies at 25 degrees. The Phantoae agglomerans, they are formerly Enterobacter agglomerans. Their septicemia, their for fluids contamination in the healthcare setting. They are triple decarboxylase negative, ODC negative, LDC negative, and ADH negative. Okay, their Enterobacter aerogenes is that their colonies are purple with the same time that they are dark red in the background. So as you can see, so one thing that we can show is that we need to check the pad. The pad of the Enterobacter aerogenes is orange, while their TSI is yellow. Their SLA is blue. So yeah. So now let's go with the Chronobacter species. The Chronobacter sakazaki are the neonatal infections, while the Chronobacter of Malonaticus are the adult infections. They are formerly classified as Enterobacter sakazaki. They are associated with bacteremia, meningitis, and necrotizing colitis. They are yellow pigment, best demonstrated at 25 degrees. They are resistant to ampicillin and first and second generation cephalosporins because of AMPC chromosomal beta lactamase. Their Voges Prosker tests are negative actually. So let's go on with the genus Hafnia. The H. alvi are the Enterobacter hafniae. They are SLF, their endo is negative, their citrate is negative, and their urease is negative. Their lysine and ornithine decarboxylase are positive. There are more positive results at 25 degrees. Now let's go with the genus Sriracha. The Sriracha marcescens are the nosocomial infection often associated with medical devices, urinary catheters, respirators, and for fluids. They are motile, their urease is V, SLF, their ONPG is positive, their TSI is equal. Their IMVIC are negative, and positive. They are prodigiosin is that they are 2-methyl, 3-amyl. They have 6-methoxyprodigiosin is that equal to red pigment, especially at 25 degrees. They are non-water soluble. They are pseudohemotipsis in RTI. They have 3 extracellular enzymes, which they are the deoxyribonuclease or DNase, the gelatinase, and the lipase. The Sriracha are the opportunistic pathogens associated with outbreak in healthcare setting, bacteremia, urinary, respiratory tract infection, The Serratia marcescens and Serratia rhobidae are the pigment producer. They are prodigiosen or the red pigment. They are Serratia marcescens are the negative for malonate. Their IMVC are positive, negative, positive, negative. The Serratia rhobidea is the positive for the alunate. So as you can see, the Serratia marcescens is that they are white colonies with the dark red background, or it can either be a white dirty background with a reddish with a very red the colonies. So in order to in order to identify the Serratia marcescens, their pad is yellow, their TSI is alkaline and acid, which the pink is the slant and the bat is the yellow, and their SLA is blue. So moving on the genus Edwardsiella, the Edwardsiella tarda are normal flora of GIT of cold-blooded animals. For an example, like reptiles, fish, or turtles. This may cause wound infection or myonecrosis, gastroenteritis, septicemia, meningitis, and liver disease. They are immunocompromised persons are susceptible. The NLF H2S is positive and indole is positive. They are motile also. They resemble salmonella in biochemical reaction. So Edwardsiella tarda is an opportunistic pathogens, causes bacteremia, wound infection. There are aquatic incidents similar to IMVC with Edwardsiella coli, but it is H2S production is positive and their LDS is positive. The TSI is that K/AJ. So okay, let's move on to genus Citrobacter. We have the Citrobacter freyonde, which there are LF, some SLF. They are urease V. They are motile, and there are most strains are H2S production are positive. Their IMVIC is negative, positive, negative, positive, and their EMB is greenish to metallic sheen. They may harbor inducible AMPC genes that encode resistance to ampicillin and first-generation cephalosporin. So the Citrobacter freyonde is that their description is reddish, kind of reddish against their colonies is more like whitish reddish, and their background is yellowish reddish. If there is also the dark background with a greenish colony. So their Citrobacter freyonde is the pod is yellow darkish. Their TSI is acid with an aerobically, and their SLA is blue. Okay, let's move on to Proteus. The Proteus, Providencia, and the Morganella group. There are NLF, they are motile, they are rapid and abundant urease, they deaminate the lysine and phenylalanine. They are genus Proteus, they are abundant H2S, noted for rapid motility like swarming growth on planted media with chaff foul odor. They are chocolate cake or burnt chocolate. They're phenylethylene alcohol agar or PEA, which there is 3 species in the Proteus. Under the Proteus, we have the Proteus vulgaris, which their indole production is positive, while their O decarboxylation is negative. In the Proteus mirabilis is that their indole production is negative and their O decarboxylation is positive. In the Proteus peneri, which is they are rare, their indole production is negative, while at the same time in the O decarboxylation is negative. Their UTI is associated with formation of renal calculi. The Proteus vulgaris OX2 and OX9. The Proteus mirabilis are OXK equals AGS used in Will-Felix reaction to to decarboxylation the rickettsial disease. So we have genus Providentia. There is Providentia ritgeri, or the Proteus ritgeri is equal to UTI. We have Providentia stuarti, which their major pathogen in burn infection, and they're negative in H2S, and their citrate is positive and their OD is negative. We have the genus Morganella, which the Morganella morgani is the Proteus of morgani, which they are UTI, can be found the UTI, which they are H2S negative, they are citrate negative, and they're OD positive. So let's move on. So in summary, the Providentia vulgaris is that in their H2S production they are positive, in the OD is negative. Their indole is positive, and their citrate is positive. In the Providentia mirabilis, their H2S is positive, while their OD is positive. Their indole is negative, and their citrate is positive. In the Providentia ritgeri, their H2S is negative, while their OD is negative. Their indole is positive, and their citrate is positive. In the in the Morganella morgani, their H2S is negative, their OD is positive, their indole is positive, and their citrate is negative. The NLF motile urase is positive, while their LIA equals red over yellow, their PAS is positive. So in summary, Proteus, they are UTIs. They are found in UTIs, wound, ear infection, nosocomial infection, kidney stone formation. There are strutevite crystal formation, particularly the Providentia mirabilis. Key characteristics, which are swarming colonies. The Proteus vulganaris is that their TSI is K over AJ positive. Their LIA is red over R over A. Their indole is positive. Their MR is positive. The VP is negative. The CIT is positive. The LDC is negative. The ODC is negative. In the year H2S is positive. While in the Proteus mirabilis, their TSI is K over AJ positive. Their LIA is R over A. Their indole is negative. Their MR is positive. Their VP is negative. Their CIT is positive, their LDC is negative, their ODC is positive, and their H2S is positive. Their providentia is that the causes of UTI, diarrhea among travelers, nosocomial infection. Their providentia stuarti are the burn units, while the providentia ritgeri are the UTI or the diarrhea, which they are urease positive. The Morganella morgani is implicated in UTIs, neonatal sepsis. The Providentia ritgeri in the TSI is K over A. Their LIA is the result of the R over A. Their indole is positive. Their MR is positive. Their VP is negative. Their CIT is positive. And their H2S is positive. In the Morganella morgani, their TSI is K over A. Their LIA is R over A. Their indole is positive. Their MR is positive. Their VP is negative. Their CIT is negative. And their H2S is positive. Sir, how do we differentiate the PPMs then, since the PAD test already gives a clue? So we have the using methylene blue agar going to LIA, which resulted the red over Y, red over yellow. The PAD is positive. If it is H2S producer, then it could be Proteus mirabilis, while the trypton of it is that it is the indole is negative, in their OD is positive. If it is Proteus vulganaris, then the trypton is indole is positive and the OD is negative. If it is not H2S producer, the Providentia ritgeri citrate is positive, while the Morganella morgani is their citrate is negative. So here is the Proteus mirabilis, which cannot clear the colonies actually. More like whitish on red in the background while they are red. If it is a yellow background, so they are yellowish, so it is really not clear. The Proteus mirabilis is the, we have to look at the pad, which is greenish, darkish greenish with a slant of the darkish greenish, while their tesi is pinkish with, their slant is pink, while their tsi is, the butt is H2S production which blackens, while the SLA is blue. In the Proteus rettgeri, in the Proteus rettgeri, their pad is is light green with a slant of a dark green, while their tesi is pink with a yellow. So that's a good sign. So alkaline over acid, and their SLA is blue. So the, what is that called again? The Morganella Morgani. Their pad is still green with a dark green slant, and their tesi is pink slant with a yellow, what we call yellow butt. So they're alkaline over acid, but the difference is that their SLA is green. So yeah. So let's move on to true overt enteric pathogens. They produce disease as soon as they enter the body, regardless if sterile or not. They usually cause harm even in the gastrointestinal tract, and are not normal flora in the gastrointestinal tract at all. Presence in antibody is most certain clinically significant and may cause disease in healthy individuals. So genus Salmonella is that they are pathogenics for man or animals. They do not ferment lactose nor sucrose. Their H2S production is positive except for Salmonella paratype and some strains of Salmonella choleraesus. They're aerogenic except the Salmonella type and Salmonella gallinarum. They are motile except for Salmonella gallinarum and Salmonella polorum. Their lysine decarboxylase are positive except for Salmonella paratype A. There are ornithine decarboxylase positive except for Salmonella type B. Their indole is negative, their MR is positive, and their VP is negative. The citrate naman is negative for Salmonella type and Salmonella paratype A, while the B naman is for Salmonella choleraesus, and positive naman is for the others. So in summary of the table, the Salmonella type in the TSI reaction, it is alkaline over acid with H2S production, which their IMVIC is that the result of it is negative, positive, negative, negative. Their LIA naman is P over P, while their OD is negative. In the Salmonella paratype A, their IMVIC is that negative, positive, negative, negative, while their LIA naman is P over Y, which their OD naman is positive. The Salmonella enteriditis is that their TSI is nothing, but the IMVIC is that negative, positive, negative, positive, while their LIA naman is P over P, which their OD is negative. So we're going to the salmonellosis, which there are fecal oral route. Their infective dose is 10 over 5 organisms, which is very, very large number. There are three general categories of salmonellosis, which first, the gastroenteritis. They are self-limiting, last 2 to 5 days. Most common salmonellosis in man that infects small and large intestines. They remain localized in gastrointestinal tract. They are caused by any species, mostly common by Salmonella typhimurium and Salmonella enteriditis or the Gartner's bacillus. Their incubation period is 1 to 2 days. Their symptoms naman is nausea, vomiting, and diarrhea. So the next is the bacteremia and the extraintestinal infection, which they are from the gastrointestinal tracts, or origin is there enter the bloodstream and infects any tissue like pneumonia, meningitis, and osteomyelitis. Their infection does not involve the gastrointestinal tract, caused by any species, most commonly by Salmonella choleraeosis or Salmonella dublin. Their symptoms naman is fever, chills, anorexia, and anemia. Now let's move on the third day, the enteric fever, which they are life-threatening, prolonged fever, and multi-organ involvement. The inflammation of SI, the invasion of LNs, the BLD stream, and infect organs and tissue is equals to the liver, kidney, BM, spleen, gallbladder, sometimes the heart. So let's move on the typhoid fever. Their most severe form of in EF. Their Salmonella typhi is that man is the only known host transmitted by deceased person or carriers. There are convalescent carriers, which are 40 to 45% of patients shed the back for short period only, while chronic carriers are about 3% of patients sheds the back for more than 1 year. Majority are women with gallbladder disease. There are typhoid Mary. So there are stool or rectal swab culture is done to detect carriers. Their incubation period of the typhoid fever is 2 weeks, and their symptoms of it is headache, anorexia, abdominal pain, weakness, raw spots, abdomen, and fever. In some patients, the Salmonella typhi ulcerate and perforate the intestinal walls or the peritonitis. There are multi-drug resistant typhoid fever or the MDR-TF. They are caused by Salmonella typhi strains resistant to chloramphenicol or the ampicillin and cotrimoxazole. They are associated with the overuse, misuse, and inappropriate use of antibiotic therapy. And yeah, we're going to discuss the paratyphoid fever, which they are the milder in manifestation and shorter in duration. We have the Salmonella paratype A, which equals to Salmonella para A. Then we have the Salmonella Schott-Moellere, which is equal to Salmonella para B. And we have Salmonella Hirschfeldi, which equals to Salmonella para C. It is in the Middle East. There are determinants of pathogenicity, which they are enteroinvasive, enterotoxin, which similar to LT and ST, cytotoxins, and the gastroenteritis. Na the Salmonella typhi or the paratyphoid bacilli and Salmonella choleraeosis, etc. They invade the bloodstream and release endotoxins, and it causes fever, shock, and multi-organ failure. Some organs are VIAJ. Salmonella typhi grows intracellular in monocytes. Their laboratory diagnosis is that the isolation from clinical specimens, which this is the blood culture, which enterics, fevers, and septicemias, best test during first 2 weeks of disease. In typhoid fever, positive would be in 80% of PTS during first week, positive in 25% of PTS by the 4th week. Now, there is the stool culture also, which the gastroenteritis is positive during first week. Enteric fevers are also positive for indefinite period. In typhoid fever, positive in 25% of PTS during first week, while in positive in 85% of PTS during third week. We have also the urine culture, which enterics the fever and septicemias. They are positive between first and fourth week of disease. We have also the sputum and CSF culture, which to diagnose complication of Salmonella infections. Isolate on media is -2 biochem -ID -serotype. is the example of Salmonella typhi positive with VI and GRP, the anti-sera. We have the Widal test, which measures antibodies against the O, H, and VI antigens. The antibodies are detected in the serum of patients from second week of infection. Their interpretation is that Widal test, baseline titers anti-O equals 50, anti-H equals 80. High titer of anti-H and anti-O is active TY infection, and the high anti-H and low anti-O is the carrier state, previous infection or previous vaccination. The low anti-H and high anti-O is that it means that active TY, which is the 14%, and the last but not the least, the any titer of anti-VI is active TY or carrier state. Now let's talk about the typidot. Is another test. It's another serologic test. They are more sensitive than Widal test. Test is positive within 2 to 3 days of infection. Their qualitative test detects presence of IgM and IgG antibodies in serum of patients. Their interpretation is that IgM positive is an acute typhoid fever. Their IgM and IgG is an acute typhoid in middle stage. Their IgG is positive previous infection or relapse or reinfection. Their true pathogens. So let's discuss the true pathogens. The Salmonella. It causes gastroenteritis, enteric fever, typhoid fever, bacteremia, sepsis, which there are MOT, ingestion of contaminated water, milk, dairy product, shellfish, poultry product, meats. The Salmonella typhi murium is the most common cause of gastroenteritis or in the enterocolitis. There are food poisoning also, like poultry and dairy product. The Salmonella coleracus is a bacteremia and sepsis. The Salmonella paratype A is the H2S negative and LDC negative. There are non-motile members like Salmonella polorum and Salmonella gallinarum. The Salmonella typhi is the most important cause of typhoid fever. The typhoid fever is the enteric fever, which the first week is that fever, dull frontal fever. First week is that they have fever, dull frontal headache, malaise, body pain, constipated, scabrous stool. Best sample to be submitted blood. In the second and third week, the symptoms would be intestinal tract, rose spots appears, diarrheic stool. Sample to be submitted would be the stool. So the Salmonella enteritis, it results in the TSI, it results that K over AJ positive. The LI naman is K over K positive. The indole is negative. The MR is positive. The VP is negative. The citrate is positive. The LDC is positive. The ODC is positive. The ADV is V. And the H2S is positive. In the Salmonella typhi naman, the TSI is the K over A positive. The LIA naman is the result of K over K positive. The indole is negative. The MR is positive. The VP is negative. The citrate is negative. The LDC is positive. The ODC is negative. The ADH is negative. And the H2S is positive with aristosis. So in the Salmonella arizonae, the TSI is A over AG positive. The LIA reaction is K over K positive. The indole is negative. The MR is positive. The VP is negative. The citrate is positive. The LDC is positive. The ODC is positive. The ADH is positive. And the H2S is positive. In the Citrobacter freondae, the TSI is A over AJ positive. The LIA reaction naman is K over A. Their indole is negative. The MR is positive. The VP is negative. The citrate is positive. The LDC is positive. The ODC is negative. The ADH is B. And the H2S is positive. So here is the Salmonella typhi. So we're going to look at the PAD, which is yellow-orange. The TSI naman is alkaline over acid. The slant is the alkaline and the acid is the butt. So with the H2S production, and the SLA is in the citrate test is the green. The result is green. So let's going with the genus Shingilla, which they are bacillary dysentery. They are painful diarrhea with with blood, mucus, and pus in stool. We have the Shingilla dysentery. Their serogroup is A, and their serotype is 1 to 10. We have Shingilla flexneri. Their serogroup is B. Their serotype is 1 to 6. Tapos X and Y. That's their serotypes. We have Shingilla boydii, which their serogroup is C. Their serotype is 1 to 15. And we have Shingilla sonei, which their serogroup is D and their serotype is 1. So genus Shingilla are known to be the man is the only known host. They are fecal oral route from infected person or carrier, can be spread by flies, fingers, food, or feces. Their infective dose as few as 10 organisms. Their infection is almost always limited to the gastrointestinal tract. There are enteroinvasive inflammation, ulceration of enterocytes. They produce Shiga toxins, STX, which the exotoxin, which is neurotoxic, cytotoxic, and enterotoxic. Their STX2D is bloody diarrhea and pus. So the Shingilla sonei is the most common isolate, may produce only watery diarrhea. Their Shingilla dysentery 1 is more severe illness and may cause HUS, which they are 20% mortality. The biochemical properties. So the SSA is colorless in colorless colony. They are non-motile and non-capsulated. They are anaerogenic, except some strains of Shingilla flexneri and Shingilla flexneri 6 and Shingilla boydii 14. There are non-lactose fermenters, except Shingilla sonei SLF. There are indole negative for Shingilla sonei. Others are neutral or V. Their citrate is negative and their H2S is negative also. Their LIA reaction is P over Y. Their OD is negative except for Salmonella Shingilla sonei. There are lab diagnosis. There is stool culture or rectal swab of an ulcer taken by sigmoidoscopic examination. They do serotyping for definitive ID. Their Shingilla is related to Escherichia. They are biochemically inert members of family Enterobacteriaceae. They causes the shingillosis, the bacillary dysentery, the enterocolitis. Their manifestation is that they are fever, chills, cramps, diarrhea, pain, and tenesmus. 20 to 48 hours after ingestion, they are bloody with pus and mucus too. Their MOT is fecal oral contaminated food and water. Their low infective dose, which the Shingilla dysentery is the TSI reaction is K over A, LIA reaction is K over A. Their indole is V. Their MR is positive. Their VP is negative. Their citrate is negative. Their LDC is negative. Their ODC is negative. Their ADH is negative. Their catalase is negative. Their ONPG and mannitol are all negative. Only MR is positive actually. And the Shingilla flexneri strongs, their TSI and LIA reaction is K over A. Their indole is V. Their only positive is the MR, the catalase, and the mannitol. That's their only positive. In the Shingilla boydii, the Newcastle Manchester, also known as that, their TSI and LIA are all the K over A. Wait, let's repeat it. All Shingilla, even the TSI and the LIA, are all K over A. But in the Shingilla boydii, their indole is V. Their only positive is the MR, the catalase, and the mannitol. That's their only positive. And in the Shingilla Sune, the K over same thing as the TSI and LIA, their indole is negative, their MR is positive, their catalase is positive, ONPG is positive, and mannitol positive, and also the ODC is positive. The serologic testing for Salmonella and Shingilla is based on O antigen, which this is the Salmonella sone. If we look at the pad, it's darkish yellowish sign. The TSI naman is alkaline over acid, and their SLA naman is green. Now let's move on to the genus Yersinia. There are 4 species are clinically important. The Yersinia pestis is a human plague or the Black Death transmitted via bite of an infected rat flea. They are penetrated in the skin macrophages, and PMN multiply, produce a protein and a lipoprotein antigen, the V and the WAGS. They are less susceptible to intracellular killing by other macrophages and PMNs. Ability to survive extracellularly. Other mechanisms of pathogenicity produce 3 factors: bacteriocin, the pesticin 1, coagulase, and the fibrinolysin is to promote the invasiveness of Yersinia pestis. They possesses an envelope AJ. So there are 3 clinical forms of plagues in man. The bubonic, it is the primary disease. It develops within 1 week after flea bite, not spread from person to person. Untreated bubonic plague is fatal to 75% of cases within 1 week after appearance of symptoms. Their symptoms: rapid rise of temperature, regional buboes, which there are painful swollen lymph nodes. There are bleeding under skin, the black patches, and the conjunctivitis, their congestion of the blood vessels. Their septicemic is the bloodstream and invade other tissues. The pneumonic naman is that involves the lungs, high contagious, spread from to person through aerosol and sputum. They're fatal to 100% of patients in less than 2 days after appearance of the symptoms if left untreated. Their cultural and biochem properties of the genus Yersinia is that they grow best at 25 to 30 degrees. Their blood agar is pinpoint colony in 24 hours, exhibits a rough colony, the cauliflower, in 48 hours. Their broth cultures is the stalactite pattern. Their bipolar staining is closely safety pin appearance with Wasson or Giemsa stain. There are NLF, anaerogenic, non-motile, and catalase positive in their laboratory diagnosis. Their Yersinia pestis can be isolated from the FF specimen, aspirates from buboes, pus from area of flea bite, sputum or throat swab, and the blood. They should be carefully collected, extremely hazardous, should be placed in Carey Blair TM for transfer to the lab. So this is the infected rat flea, the blood agar, white with a red background. The stalactite pattern, it should be look like from the cave in the Palawan, which it has the waters, and the bubonic also does the black skinning because of the apoptosis or the cell death. They do the buboes, which inflames the part of the skin. So the yersiniosis denotes the infection with Yersinia species other than Yersinia pestis. A zoonotic disease acquired accidentally by man from wild and domestic animals, spread via fecal oral route. Their symptoms naman is fever, swelling of mesenteric lymph nodes, and severe abdominal pain which mimics appendicitis. They are caused by Yersinia enterocolectica, the Yersinia pseudotuberculosis, and Yersinia intermedia. They are less common. The Yersinia enterocolectica naman is caused the gastroenteritis. They are enteroinvasive and heat-stable enterotoxin. They are grow best at RT. slower at 37 degrees. Their blood agar naman is alpha hemolytic colonies. Their stool culture naman is cold enrichment technique. Their CIN naman is bullseye colonies after 48 hours. Their motility is clearly noted at RT, not at 37 degrees. Their SLF naman is ferment sucrose rapidly, anaerogenic. Their OD is positive. They are mostly urease positive. BP is positive only at RT. The pseudotuberculosis naman also motile at RT only. They are anaerogenic, does not ferment lactose nor sucrose. OD is negative. Their VP is negative. Their urease is positive. Their lab diagnosis is isolation of bacteria from mesenteric lymph nodes, feces, and blood. Their CIN agar is that they are the bullseye, like their whitish sides with a red center, and their background is red actually. So yeah. So in summaries, Yersinia are the zoonotic non-motile at 37 degrees disease of rodents. The Yersinia pestis is the causative agent of plague, bubonic plague, and the Black Death, transmitted by the bite of rat fleas or Xenopisla schiopsis. Their SNS high fever, headache, and bobos, hemorrhage, blackish discoloration. Their inclusion body presence is the bipolar bodies. Stain employed is the Wasson stain. Safety pin appearance. Their Yersinia pseudotuberculosis is the animal pathogens or the pseudotubercles. Acute mesenteric lymphitis or the septicemia. And the Yersinia enterocolitica is the most common isolated Yersinia species, which they are reservoirs of pigs, undergo cold enrichment, contaminant of BLD products, causes yersinosis. MOT is the ingestion of contaminated food, pork, meat, and milk. Their SNS mimics appendicitis, entericitis, arthritis, erythema, nudosum, septicemia, PX with hemochromatosis. Their culture medium is CIN, cephaloidin, ergasan, novobiocin. Agar is the bullseye colonies. Their characteristics appearance colonies is the Yersinia pestis, which their TSI is A over A. Their I is V. Their M is positive. Their IMVC naman is, the pattern is neutral to positive, negative, negative. Their urease is also negative. Their LDC negative. So they are all negative actually. The only positive is the M in the IMVC, and the I is neutral. The Yersinia enterocolitica naman is their TSI is A over A. Their I is negative. Their M is positive. Their urease is positive. Their ODC is positive. Their sucrose is positive. And their motility is positive. The rest is negative. In the Yersinia pseudotuberculosis naman, A over A naman, the only positive is the M and the motility. Okay, let's move on to... So, Acinetobacter species, Pseudomonas or Chrysomonas luteola, the Pseudomonas or the Flavimonas or Oryzhabitans, and the Stenotropomans maltophilia. Their common properties are the oxidase naman is negative. Their Mankaki naman is positive. Their oxidizer of glucose or asaccharolitic naman. They are grow well on routine media. They are opportunistic pathogens with no definitive virulence factors, known as some have LPS capsule, fibray, survive in dry environment. Their Acinetobacter species and Salmonella maltophilia are the second and third most commonly isolated NFB, both associated with nosocomial infection, the ICU patients, surgery patients, cancer patients, and HIV patients. Their oxidative fermentive or OF medium is the basal medium, which is 1% CHO. 0.2% peptone and bromthymol blue. There are 2 tubes of OF med of or OF glucose, stabbing 3 to 5x. There are overlay 1 tube with petrolatum or paraffin. There are 37 degrees for 24 to 48 hours, some up to 7 days actually. The result is that if it is unsealed open, it is yellow, yellow A, and the blue-green. The sealed paraffin naman is that the yellow A, the green is negative, the green is negative. Blue or green, actually in the unsealed naman there is blue or green negative actually. So the interpretation naman is that there are fermenters. If the unsealed open is yellow and the sealed naman is yellow pod, then the interpretation of it is fermenters. If it is yellow and green, the unsealed is yellow and the sealed is green, it is oxidizers. If it is unsealed is blue or green, the results of it is blue or green, which negatives, and the sealed naman is green, then it can either be the interpretation of it is the as a carolytic or non-oxidizer or non-utilizer. So here it is. So yeah. So let's go with the genus Acinetobacter. They are opportunists. There are ingeo, septicemia, meningitis, wound infection. There are blood agar. There are smooth, opaque, raised, creamy, and smaller than enterics. Some are beta hem. They are MAC is equals to NLF, but colonies exhibit a purplish hue that may be mistakenly for LF. There are gram-negative diplococcoid bacilli. There are TSI, alkaline over no change. They show bipolar staining with Wasson or Giemsa. They are non-motile, does not reduce nitrate or to nitrite. They are catalyst positive, resistant to penicillin, maybe MDR or XDR, AMPC, beta-lactamases. They are gram-negative diplococcoid bacilli. So the species naman is Acinetobacter calcoaceticus. There are 2 variants. The Acinetobacter calcoaticus or variants of Anitratus, the Archirella viginicola, and we have the Acinetobacter calcoaceticus var IWF. There are Mima polymorpha. There are 6 species naman. We have Acinetobacter calcoaceticus, which their OF glucose naman is positive, their citrate is positive, their growth at 42 degrees Celsius and negative. Their Acinetobacter naman is Boamani. Their OF glucose is positive, their citrate is positive, their growth at 42 degrees is positive also. In the Acinetobacter hemolyticus naman, there are positive and negative OF glucose, positive or negative. They are either be positive or negative. Their citrate is positive naman. Their growth at 42 degrees is that they are negative. Their beta hemolyticus. The Acinetobacter IWF is that OF glucose is negative, citrate is negative, growth at 42 degrees is negative. The Acinetobacter johnsoni is that their OF glucose is negative, their citrate is positive, and their growth at 42 degrees is negative. Their Acinetobacter joni is that OF glucose is negative, the citrate is positive, and the growth at 42 degrees is positive. The genus is divided into 4 simpler groups. The Acinetobacter species is the sarcarolytic and non-hemolytic. The Acinetobacter species naman is the sarcarolytic and hemolytic. Then we have the acicarolytic and non-hemolytic. Then the asacarolytic and hemolytic. So, in summarize, the Acinetobacter baumannii, formerly called as Mima, they are gram-negative coccobacilli. Diplococci oxidase is negative, non-motile. They are second most commonly isolated non-fermenters in the laboratory. The RGA is mistakenly for Nersea. There are growth on mac, bluish or peach to pink tint, NLF, ammonia-like odor. On blood agar plate, there are large gummy translucent gray-white convex and tart colonies. On EMB, cornflowers blue color, widely distributed in nature and in hospital environment. For urinary catheters in ICU, they are associated with combat injuries in Iran and Afghanistan. Grow at 42 degrees. They are most likely P. aeruginosa. So we have the next is we have the Stenotrophomonas or Maltophilia. There's Pseudomonas maltophilia or Xanthomonas dermatophilia. Their blood agar is rough lavender green with NH3-like smell. Their TSA naman is yellow to brown pigment. They are motile with peritrichous flagella. They oxidize maltose faster than glucose, one of the few NFB that decarboxylates lysines. So Streptotrophomonas maltophilia, they're the third most commonly isolated non-fermenters in clinical laboratory. The oxidize is negative. They're motile, growth at 42 degrees. They are maltose lover. Their LDC, ONPG, and DNase is positive. Okay, we're going to Mankaki positive and oxidase positive in their gram-negative rods. That's our next topic naman. So we have the species. We have the Burkholderia species, the Bribondimonas, the Ralstonia picitae, the Pseudomonas species, the CDC group IC. At one time, were all members of genus Pseudomonas. Their common properties: they are gram-negative, straight, and slender bacilli. They oxidase positive, strict aerobes. Their macaque is positive except Bribondimonas vesicularis. They are motile with polar flagella except Burkholderia malay. They are mostly mesophilic. Some are psychrophilic. There are oxidizers of carbohydrates. They do not produce acetoin. They grow well in routine media like blood agar, CA, BH, IB, the NT, tayo. They are resistant to most antimicrobial agents, sensitive to aminoglycosides and cholestins. We have let's start with the genus Burkholderia. They are environmental inhabitants and not part of normal flora. They are able to survive in medical devices and disinfectants. The Burkholderia cepacia, formerly Pseudomonas cepacia, are there are a NFB that decarboxylates lysine. There are common isolates from patients with cystic fibrosis next to P. aeruginosus. They are cause life-threatening infection in patients with cystic fibrosis. Their selective media is Pseudomonas cepacia's agar or the PC agar. Their oxidative fermentive base polymyxin B, beta bacitracin lactose, or the OFPBL. That's their selective media. There are smooth colonies, 72 hours and 35 degrees. So, Burkholderia malay or the Pseudomonas malay, it causes zoonotic infection, severe infection in horses. There are glandular disease, which is the inflammation of lymph nodes. They are non-motile, fails to grow at 42 degrees, may not grow on blood agar, BHIA with glycerol, medium of choice. The Burkholderia gladioli, a plant pathogen rarely found in sputa of patients with cystic fibrosis. There are Ralstonia picitae. They are the environmental organism occasionally found in blood, urine, and sputa of patients with cystic fibrosis. Which the Burkholderia pseudomole is the Pseudomonas pseudomole, found only in Australia and sea, causes zoonotic infection acquired by man via inhalation or skin abrasion, can survive within human macrophages. There are melioidosis, which is the pneumonia-like and often fatal. They are able to grow at 42 degrees. grows slowly on blood agar, ash down medium, dry wrinkled violet purple. Burkholderia cipacea is the plant pathogen causing onion bulb rot and foot rot. There are causes pneumonia, UTIs among humans. They oxidize and LDC positive and ADH negative. Their Burkholderia malae is the disease animal infection of horses. They are non-motile ADH positive. There are pseudomalae called Landers Farcy disease. The disease naman is melioidosis or Vietnam time bomb. Their potential bioterror agent. Their selective medium naman is ash down medium, which the colonies is the deep pink. Grow at 42 degrees. The ADH is positive. In the odor, earthly odor naman. The genus Pseudomonas naman is comprise several environmental species that rarely inhabits human skin or mucosal surfaces. It survives in moist areas of homes and hospitals. Ability to survive in water with minimal nutrients. Their Pseudomonas aeruginosa is mostly common isolated in NFB. They are opportunistic pathogens that can cause community or hospital-acquired infection, such as folliculitis, UTI, eye infection, which is the trauma, use of contaminated contact lens solution, that's the results of an eye infection, and the external ear canal infection or otitis externa. The endocarditis in for drug user, the respiratory tract infection, the bacteremia, the eczema gangrenosum. It's the formation of cutaneous papules that becomes black and necrotic. They are severe in secondary infection in burn patient and in patient with cystic fibrosis. Their determinants of pathogenicity, the exotoxin A, kills host cells, the endotoxin, the proteolytic enzyme, and hemolysins. The pili and the SS produce agenate, which is the polysaccharide polymer that makes up the capsule. So here is the folliculitis. It has the red spots on it. Then the nail disease. The nail has colored green already. It is colorful. The eye infection also has a color green now. The leg ulcer is parang lata na. The eczema gangrenosum is that they have a black spot on it. Their cultural and biochem properties on the genus Pseudomonas. On differential media, they are flat colorless or grayish, spreading along streak lines. Their blood agar naman is flat and spreading, serrated edges, often with metallic sheen and beta hem. Their mucoid colonies naman is agenate forming, seen in patient with cystic fibrosis. They are grape-like or corn taco-like odor. They are motile with monotrichous flagellum. Their TSI naman is alkaline over no change or alkaline over alkaline with glassy colonies. Their oxidizes naman glucose but not maltose. There are citrate positive. The nitric reduction is positive. Can grow at 42 degrees. So in the pigments naman, we have the pyocyanine, which are the turquoise blue or blue-green. They are water-soluble and chloroform extractable. They are Pseudomonas P. agar or King's A medium. They are pyoverdine or fluorescin. They are yellow-green, which is they are water-soluble but not chloroform extractable. They are Pseudomonas F. agar or King's B medium. We have the few strains produce pyorubin or pyomelanin. There are alginate forming colonies may not produce the pigments and react slower in biochem tests. Require 7 days incubation. You have the blood agar naman. So this is the blood agar. They have white colonies with a reddish background. Then the macaque naman is they have white background with a dirty white background. The monotrichous, the sensitivity testing, the pyomycin. So now let's go with the Pseudomonas fluorescens and Pseudomonas putida. They may produce fluorescence pigments. They do not grow at 42 degrees. They are motile with polar terps of 4 to 6 flagella. They are psychrophilic. The Pseudomonas fluorescens is liquefies gelatin, while the Pseudomonas putida is gelatin hydrolysis negative. So, in summary, we have the Pseudomonas aeruginosa is the most common non-fermenters isolated, which obligates the aerob. They are motile, they are oxidase positive and catalase positive. They are non-fermenters but oxidizers, able to grow at 42 degrees. They produces blue-green pigment, pyocyanin, the blue, which exclusive pigments of Pseudomonas aeruginosas. Pyoverdin is the green. So the odor naman is corn taco or corn tortilla. Their fruity odor, 2-amino acetoquinone. On the blood agar plate, there are feathered edges colonies which they are beta hemolytic. Associated disease is that bacteremia, skin infection, swimmer's ear, jacuzzi syndrome, hot tube syndrome, and severe pneumonia. Among CF patients, otitis externa. They are resistant to most antimicrobial because of its unusual porins channel. They are capsule composed of alginate, capsulated IF isolated from CF patients. The pyocyanin is the Pseudomonas aeruginosas is positive only. The Pseudomonas putida, okay, let's start with Pseudomonas aeruginosas. Their pyocyanin production is positive. Their pyoverdin production is positive also. Their gelatinase is positive. Their xylose oxidizer is yes. Their ADH is positive. Their growth in centramide is positive also. Their acetamide utilization is positive. And their growth at 42 degrees is positive. So that's the description of the Pseudomonas aeruginosa. The rest are negative. While in the Pseudomonas putida, the only positive is the pyoverdin production is positive. The xylose oxidizer is yes. The ADH is positive. And the rest is negative. In the Pseudomonas fluorescens naman, the pyoverdin is positive. The NO3 reducer is positive. The xylose oxidizer is positive. The xylose oxidizer is yes. The gelatinase is positive. Their ADH is positive, and the rest is negative. If non-fermentals, oxidizers are positive, LDC is negative, and most likely Pseudomonas aeruginosas. So this is the Pseudomonas aeruginosas. It has white background with pinkish red. It's pinkish red background with white colonies. The pad is yellowish greenish, yellowish oranges. The TSI naman is alkaline and no change. Alkaline over alkaline, so there is no change at all. So the SLA is blue. Now we're going to talk about the Rhizombium radiobacter, the Ochrobacterium anthropi, the Psychrobacter immobilis, the Alkaligenes psilocydans, the Acidovorax species, the Acromobacter species, the Schwalnilla species. Their common characters is that the macaque positive, they're oxidase positive, they're glucose oxidizers, they grow well in routine media. There are environmental inhabitants rarely encountered in human infection. There are infections are associated with use of medical devices, example intravenous and urinary catheters. They may cause endocarditis, meningitis, and UTI. And let's start with the Rhizobium radiobacter. They are formerly CDC group VD3, the Agrobacterium radiobacter. They are gram-negative, short. They are pleomorphic rods. They are motile with peritrichous flagella. There are oxidized glucose, xylose, and mannitol. They are positive catalase, urease, esculin hydrolysis. They are NO3 reduction, negative. Then we have the Ochrobacterium anthropi. They are CDC group VD. They are gram-negative medium-sized straight rods. They are motiles with peritrichous flagella. They're oxidized glucose in xylose, mannitol B, and their positive catalase in urease. The NO3 reduction is B. Their esculin hydrolysis is negative. So we have the alkali genes xylozodians or the Acrobacter xylozodans. Their blood agar naman is smooth glistening entire. They're motile with peritrichous flagella. They are oxidized xylose. Their N-glucose slow or negative. Their citrate is positive and their nitrate reduction is positive. So yeah, that's the description of the alkali genes xylozodans. So we're going to Shewanella putrefaciens, or formerly known as the Pseudomonas putrefaciens. They are found in environment and foodstuffs, causes otitis media and septicemia. They are motile with polar turf or flagella. They are citrate negative. Only NFB that produces H2S is the TSI. Then now let's talk with the Chrysobacterium species, the Spingobacterium species, the Empidobacter privis. They are former members of genus Flavobacterium. They are environmental inhabitants occasionally encountered in human species. Their common properties is the oxidase is positive, the macaque is positive, except for Shingilla mesotai. Example for that is Shingilla mesotai. There are glucose oxidizers. They are yellow pigmented, containing contaminants in lab media. Their ability to survive in chlorinated tap water. They survive in moist areas in hospitals. Non-nosocomial infection. They grow well in routine media. Now we have now let's talk about the Elizabethingia meningoseptica. They are formerly named as Chrysobacterium meningosepticum or the Flavobacterium meningosepticum and CDC group area. They cause neonatal meningitis and septicemia. May be transmitted from birth canal to neonate. They causes the meningitis in compromised to adults, nosocomial meningitis and pneumonia. The blood agar is a large yellow smooth circular in entire edge. They are gram-negative long, thin, straight rods with swollen ends, often appear as two forms. They are capsulated, non-motile, and endo-positive. They are gelatinase, dinase, catalase, positive. Their ONPG is positive, but it is still questionable. Now we have to talk about the Comamona species, the Psychrobacter species, the Alkali genes Phaecalis, and the Bordetella nonpertussis species, and the Oligilla species, and the Rosmona species. Their common properties is the macaque positive and their oxidase positive. They are non-glucose utilizers. They grow in routine media. There are genus Bordetella, which the three species are clinically significant. We have to discuss first the B. pertussis. This is the macaque negative. The oxidase is positive and their motility is NM, non-motile. The B. parapertussis naman is their macaque is positive, their oxidase is negative, and their motility is non-motile. The B. bronchoseptica is their macaque is positive, their oxidase is positive, and there are motility which is the peritrichous. So Bordetella bronchoseptica is a part of a normal flora of respiratory tract of mammals, dogs, cats, and rabbits. They are transmitted to man via droplet spray during close contact with animals. They may lead to pneumonia, septicemia, meningitis. Their blood agar is the description of it is small, convex, round, and 1 to 2 days incubation. They are nitrate reduction in urease positive. The alkali genes Phaecalis is a transient colonizer of skin and GIT and gastrointestinal tract of man, found in moist areas of hospitals, nosocomial infection. They are blood agar feather edge with zone of green discolorization, fruity odor with green apple or strawberry. They are motile with peritrichous flagella, and they are acicarolytic. They are nitrate reduction V, and they are citrate positive. Bronchi septica on blood agar, which is the they are white colonies with red background, and they are Phaeacalis o macaque, which they are colorish, yellowish, reddish, the macaque. Now let's go with the Vibrio arimona species. Vibrio, the arimona species, the Chromobacterium violaceum, and the Plesiomonas shigelloids or the F. Enterobacteriaceae. Their habitat is water, brackish or marine water for Vibrios, fresh water for the other genera. They are transmitted to human via ingestion of contaminated water or seafood. Their exposure of broken skin to contaminated water during swimming or handling of raw seafood. Their common properties is that their macaque is positive, which colonies resembling to enterics. Their oxidase is positive except for V. Mechnicovi. They are fermenters of glucose, facultative, anaerobic, and grow well in routine media. So let's start with the genus Vibrio. They are gram-negative Vibrios. They are motile with monotrichous flagellum, rapid darting or shooting star motility. They are halophilic except Vibrio cholerae and Vibrio mimicus. They are nitrate reduction negative, nitrate. They are sensitive to Vibrio static agent 0129 or the Vibrio static test using impregnated disc. Their blood agar medium to large, smooth, opaque with greenish hue, which they are Vibrio pluvialis, Vibrio mimicus, and Vibrio damsela, can be beta hemolytic. Their MAC is NLF except Vibrio vulnificus, which may be LF. There are 31 species of Vibrio only associated with diarrhea: the Vibrio cholerae, Vibrio pluvialis, the Vibrio parahemolyticus, the Vibrio holisae, and the Vibrio mimicus. The Vibrio cholerae naman is sensitive to acid, a pH of 6 kills the culture. The NLF naman ferments glucose, sucrose, and mannate. They are string test positive, which 0.5% and sodium deoxycholate or mucus-like string. Their media for isolation naman is transport media, which carry Blair TM, Amis TM, or they are semi-solid, maintains viability for 4 weeks. Their enrichment med is alkaline peptone H2O, which can be response to 6 to 8 hours. Their selective media naman is the TCBS, or also known as the thiosulfate citrate bile salt sucrose. They are medium to large yellow colonies. And there is another selective media, which is the TTGA, the tellurite taurocholate gelatin agar, which translucent with dark center due to tellurite reduction and surrounded by a cloudy halo gelatinase activity. And this is it's best to look at the picture lang. So we have 3 groups of Vibrio cholerae. We have the Vibrio cholerae 01 or the aglonate in Vibrio cholerae 01 anti-serum. Their cholerogene, cholerotoxin, or the CT, is 100 times more potent than LT. They are responsible for Asiatic cholera. The Vibrio cholerae 0139 is the agglutinate in Vibrio cholerae 0139 anti-serum. They are new strains capable of epidemic and pandemic spread of cholera. They are cholera toxin. They are resistant to Vibrio static agent 0129. And we have non-01 and non-0139 or the Vibrio cholerae. They are same biochem properties as 01 group. Do not agglutinate in 01 and 0139 anti-sera. Do not produce cholera toxin. Do not cause cholera associated with non-epidemic diarrhea. They may cause extraintestinal infection, and they are non-agglutinating Vibrios and NAV or non-cholera Vibrios. So in the Vibrio cholerae 0 to 1 subtypes, we have Ogawa. The O factor is A and B. The Ineba naman is their O factor is A and C, and the Hikojima naman is their O factors A, B, and C. There are two biotypes of Vibrio cholerae 01, the physiologic cha, which is the biotype cholerae classical, and the biotype L-Tor, which is the beta hemolytic on BA. The test for differentiate, we have the VP at RT. Their classical is negative, but the L-Tor is positive. When we have the clumping of chicken RBC, the classical is negative while the L-Tor is positive. The polymyxin B susceptibility is the classical, I don't know, it is S, the result is S, it says S, and the L-Tor is R. So, yeah. So, here it is. So, other virulence factor of Vibrio cholerae, there is mucinase production, allows penetration of the mucous layer. You have the toxin coregulated pili or TCP, means by which bacilli attach to mucosal cells for release of CT. We have Zoda occludens toxins or ZOT, has been shown to disrupt the right junction of the intestinal cells, effectively decreasing tissue resistance. Then we have the Asiatic cholera. It is discovered since 1817. There have 7 pandemics were documented. The IP naman is maybe the incubation period naman is the maybe hours or days, means of 2 days. Their infective dose is 10 to the power of 5 organism. Their gastrointestinal tract naman never invades bloodstream. There are severe diarrhea to 10 to 15 liters a day. Their eyes and cheeks appear sunken and hands have washerwoman's appearance. There are rice water stool, which mucus, epith cells, and vibrios. In untreated cases, the fatality rate is 60% in choleratorus. So the laboratory diagnosis is that stool culture isolate ID subtype and biotype. There are direct exam, hanging drop of alkaline, peptone water, and after 6 to 8 hours incubation, there are small rods with darting or shooting star motility. Then add Vibrio cholerae 01 anti-zero. So this is kind kadiri. Then we have the Vibrio parahemolyticus. There are gastroenteritis involving shellfish and crustaceans. Their TCBS is olive green, does not ferment sucrose. Their string test is negative. And the Kanagawa's hemolysis or heat stable, their beta hemolysis on Wagatsomas agar or TCBS. Their Vibrio vulnificus, which means that they are flesh-eating bugs. Wound infection, exposure of broken skin to contaminated water, able to invade the bloodstream via gastrointestinal tract within 24 to 48 hours after ingestion of raw shellfish or oyster. There are fatal septicemia, especially in patients suffering from liver disease. They are capsulated. There are lactose fermenters, sucrose, mostly negative. So, in summary, Vibrio are gram-negative strain or curved bacilli but can be pleomorphic. Motile with a single polar flagellum or sheathid. They are facultative anaerobes or aerobes. They are catalyst positive, oxidase positive, and nitrate reducer except Vibrio mishnikovi. They are catalyst negative, oxidase negative, and their NH3 is positive. Their glucose fermenters naman most are able to ferment sugars such as sucrose, which is the Vibrio cholerae. Most species thrives at high concentration of salt, allophilic, except Vibrio bibicus and Vibrio cholerae. Their culture medias, alkaline peptones water with 1% sodium chloride, which it has a pH of 8.5. Their blood agar plate with 0.5% of the sodium chloride. Their nutrients agar with 0.5% sodium chloride, and their TCBS naman. Their magkaki, which are the colorless colonies of MAC. They are stained with 1 to 10 carbofucsin gram stain. Their counterstain instead of saponin. The Vibrio cholerae naman is na non-halophilic. Their common name is Bacillus. Their causative agent of cholera naman is Asiatic cholera or epidemic cholera. Their Vibrio cholerae is 01. Their Vibrio cholerae is 0139 Bengal strain, which the non-01 strain do not cause cholera. There are severe gastroenteritis, which is vomiting. The rice watery stool is 10 to 30 bowel movement per day with flecks of mucus, sunken eyes, and washerwoman's hand skin. There are electrolyte loss, dehydration eventually leading to death, and their toxin responsible for choleragen. Then we have the Vibrio parahemolyticus, which the disease is the Sabardiarrhea in Japan. MOT, ingestion of raw or undercooked shellfish and seafood. They're positive for Kanagawa phenomenon, which is the double zone of hemolysis on Watgatsuba agar. Their Vibrio vulnificus is the second most virulent Vibrio after Vibrio cholerae. Their disease is primary septicemia, 40 to 60% mortality and wound infection and leading to necrotizing facilities and or multiple organ failures. They are Vibrio algidolepticus. They are occupational hazard to fishermen or sailors. So in theory, the Vibrio cholerae naman, yeah. So let's just summarize. So the only positive is the sucrose fermentation, the cholera red reaction, and the string test, and their growth on TCBS colonies is yellow. Their appearance yellow. So the rest is negative naman. So the Vibrio parahemolyticus naman is that their Manito fermentation is positive, their Kanagawa phenomenon is positive, and their growth on TCBS is blue-green. And the rest is negative naman po. So in the Vibrio vulnificus, in the succus fermentation is neutral, V. And the lactose fermentation is positive. The only positive lang ha. The ONPG is positive. And the growth on TCBS colonies is variable. So the rest is negative da. And the Vibrio aginalyticus, the succus fermentation, the only positive is the succus fermentation. It is positive. And the string test is positive. And the rest are yellow. Again, in the Vibrio vulnificus, the succus fermentation is V. The lactose fermentation is positive. The ONPG is positive and the string test is positive. And the growth on TCB is colonies as variable. Now, let's talk about the BioVar. So, the LTOR naman, we're going to do this. In the LTOR naman, the Voges precursor is positive. With the chicken RBC, there are agglutination. The polymyxin naman is R. The Gregg test RBC hemolysis naman or historical interest naman is lysis. And their camp is positive. The Pages 4 are R and the beta hemolysis is yes. In the classical naman, the Voges precursor is negative. With the chicken RBC, there are no agglutination. Their polymyxin is S. Their Gregg test RBC hemolysis or the historical interest is no lysis. The CAB is negative and the page 4 is S. The beta hemolysis is no. Then we have the genus Aeromonas, which is the Hydrophila, Asobria, and A. caviae. They are gastroenteritis, wound infection, bacteremia, endocarditis, pneumonia, meningitis, etc. They are hydrophila or flesh-eating bug. Their cultural and biochemical properties are they are gram-negative rods. They are motile with monotrichous flagellum. Their blood agar naman is large, round, raised, opaque, beta hemolytic, except A. caviae which is non-hemolytic. They do not grow on TCBS. Their CIN is bullseye or cone. Do not oxidize test. Their ferment glucose naman is A or AJ which catalyze positive. Their string test naman is negative and they are resistant to bibliostatic agent 0129. So, in summaries naman, the Aeromonas is a water-loving, recovered in aquatic environment, indole, oxidase, and catalase positive. They are facultative anaerobes. They are glucose fermenters, able to grow on macaque, AMB, SSA, and BAP beta hemolytic. Their CIN is bullseye colonies, which oxidase is positive, versus Yersinia entero is oxidase is negative. They're frequently isolated mesophilic group A, Caviae, and A. hydropila. Their other groups naman is Psychrophiliac, A. salmonicida, and they are non-motile. Their disease naman is red-ling disease among frogs, usually cellulitis and wound infection, diarrhea. May also cause septicemia, UTIs, ear infection. Now let's start with the Plasmodium shinguloids. They are now a member of family Enterobacteriaceae, the only member which is oxidase positive. It causes gastroenteritis, meningitis in neonates. There are gram-negative rods, bottle with Lopotrichos flagella. Their blood agar is shiny, opaque, smooth, and non-hemolytic. Does not grow on TCBS. Their ferments glucose A only, and decarboxylase or lysine in arginine. They catalyze is positive, their string is negative. Their sensitive to bibliostatic agent is 0129. They differentiated from Aerobodas by D-Days test, and Aerobodas are positive while Plasmodium is negative. So, in summaries, the Plasmodium shinguloids is the enteric opportunistic infection associated with diarrhea infection. Triple decarboxylase positive, inositol positive, and catalase and oxidase positive. So, the Chromobacterium violaceum, they are not associated with gastrointestinal tract infection, transmitted to man by exposure of broken skin to contaminated water. They are severe septicemia, abscess formation in liver and lungs. They are gram-negative, slightly curved. There are medium to large rods with rounded edges. They are motile with polar flagella. Their blood agar naman is round, smooth, convex with some strains of beta hemolytic, black or very dark purple, and exhibits ammonium cyanide odor or almond-like odor. There are violacin, ethanol, monosoluble violet pigment. They are resistant to vibriostatic agent 0129 and penicillin. Their presumptive ID can be made based on colonial appearance, oxidase test, and gram stain. If purple pigments interferes with oxidase test, the organization should be grown under anaerobic condition, inhibits pigments production, and is retested. So, in summary naman, other gram-negative bacilli release CO2 labeled with radioisotope measured by Scheele-T-lighting counter. So, the non-fermentative gram-negative bacilli, the TSI is K over K, mostly oxidase positive. The common characteristics are the yellow pigmented Elizabeth Kingia magneg is the Chrysobacterium magneg, which there are Pseudomonas luteula, Pseudomonas totzeri, Pseudomonas oxyhabitans, and Pseudomonas spingomonas. There are blue-green with Pseudomonas aeruginosus. There are wrinkled colonies is Pseudomonas totzeri, Pseudomonas or oryzhabitans, and beta pseudomale. The H2S positive, which is Shewanella. And there are pink pigments, which is the Rosomonas and the Methylobacterium, which their result is lavender to lavender green on BAP. There are Salmonella matopilia. They are non-motile or Acinetobacter, Chrysobacterium, Elizabeth Kingia, Spingobacterium, Oligilla orythralis, and Beta Malay. Their oxidase A negative is Acinetobacter, Salmonella bathyphylia, P. luteola, and P. pseudomonas or Z. habitans. Their purple on back Acinetobacter. Their violet is C. violicium, and their Na. Their gram-negative non-enteric organisms that are agent of diarrheal disease and other disease. So, we're going to, the Vibrio naman, so the only positive of the Vibrio is the oxidase, they are positive. They're in the gelatinase, they're positive. The growth in 6.5% of sodium chloride, they're positive. Their growth in TCBAs are positive also. And the LDC, positive, ODC, positive. And the rest is negative naman. So, the growth in 0% of sodium chloride, they are neutral, V. Their glucose fermentation is glucose. So, all of it is glucose naman sa glucose fermentation. If we say glucose fermentation, all of it is glucose. So, I think that's it. In the aeromonas naman, is that the only positive is the oxidase, gelatinase, growth in 0% sodium chloride. The LDC is positive and the ADH is positive. The DNase hemolysis, exculin hydrolysis is positive. So that's all of it. So the bibliostatic agent of 0/129 is R. Nora. And the Plissiomonas naman, it's okay. The oxidase is positive. The only positive is the oxidase. The inositol fermentation is positive. The growth in 0% sodium chloride is positive. The LDC, ODC, and ADH are all positive, which they are triple decarboxylase. So that's the only positive. And the vibriostatic agent naman is S. And I think that's the end of it.